Have you been diagnosed recently with fibromyalgia? Or have you been suffering for quite some time with pain that has been present in multiple areas of your body? Have you been having fatigue and tiredness, concentration problems, memory issues? And if so, have you had any recent blood tests done? Chances are that fibromyalgia is probably a diagnosis that your GP or your rheumatologist may offer if the blood tests are all normal. Almost 2 to 5% of the UK population now are being diagnosed with fibromyalgia. So what is it? My name is Dr. Deepak Ravindran, and I am a pain consultant for the last 10 years. And my 10 years of practice in my pain clinic here, increasingly I've been seeing a large number of fibromyalgia patients. I also have the honor and benefit of supporting a patient support group for fibromyalgia locally in my area, and I'm also part of an award-winning service that looks after fibromyalgia patients. So I have over time developed experience in looking after patients with fibromyalgia, and more importantly for understanding what it is that can be done for this very difficult condition. What is fibromyalgia, and where does a pain consultant figure in all this? The reality is that you may have experienced even from your GPs that it is a condition that they may not even be aware of, and sometimes may not even want to acknowledge the existence of. And this is a condition that a lot of you might have suffered. This is a fate that some of you may have had in not getting the support from your healthcare professionals, and sometimes from in your family who may not understand what is happening. But we understand now that fibromyalgia indeed is a very complex condition. It is a condition in which the nervous system does not behave itself and behaves in very erratic manners. And it is associated with a huge number of other comorbid or other medical conditions that can make management of this complex. And that is where a pain consultant with their expertise can bring about a difference and make a big advantage in the management of your fibromyalgia. What treatment options are available then? Well, most pain consultants will have access to a large number of other healthcare professionals that they work with in a collaborative manner. So I have access to physiotherapists and psychologists who I work with, and most times it's important that for fibromyalgia patients we understand the causes that can come. Patients may get this condition after road traffic accidents, after serious shock, bereavement, illnesses or surgery or adversity. And it's important to know what is the particular trigger that has happened in your case so that we can develop a personalized and bespoke treatment strategy. And that will involve a biopsychosocial model, which is what pain consultants are trained in. So what are you waiting for? Please speak to your GP today to get a referral to your nearest pain clinic or pain consultant. And sometimes if that is going to take too long, you may have to consider private options. Because the reality is, the more quicker you understand about fibromyalgia, the more aware you and your family members are in how to look after it, the faster you can get your quality of life.